this meeting itself won't be all that long, which is good because Phil can probably take a lot longer with the training to follow this on the new Coalition Manager tool. This will be our July 9th Coalition monthly kind of check-in meeting. We do have some updates, but not a whole heck of a lot for you today. We'll do initial roll call, go through any open tasks or due outs, and then roll through each of our reporting organizations. Give you what we can on the grant, because we really don't know at the moment, as well as some updates to just other events. So for our roll call, we'll start off with Anderson Hospital. Eric, are you on? All right. Anyone from Alton Memorial? How about Boyd Healthcare? Harlanville? How about Community Memorial Staunton? Fayette County Hospital. Tina, are you on? All right. Gateway Regional Medical Center.
Good morning. This is Mindy. I'm here.
Excellent. Holy Family. How about St. Elizabeth's?
St. Elizabeth's is here.
All right. Thank you for that. How about St. Joseph's Breeze? Anyone from St. Joseph's Highland? Jersey Community Hospital.
Julie's here.
Good morning, Julie. For Memorial Hospitals, Belleville and Shiloh, you got myself and Phil is on here. He'll be covering for BJC. How about Memorial Hospital Chester? OSF St. Anthony's?
Hi, it's Tracy. I'm here.
Good morning, Tracy. Anyone from Redbud Regional? How about Sparta Community Hospital?
Dale is on.
Morning, Dale. And how about Touche? Jade, are you on with us?
Yes, sir.
Excellent. Moving over to our health departments. We have anybody from Bond? How about Calhoun County? Anyone from Clinton County?
Hey,
I see
I'm
Wendy.
here. This is Wendy from
I
Bond.
see you, Wendy. Okay. Eastside Health District. Fayette County Health Department.
Kendra's here.
Morning, Kendra. How about Greene County? I got you, Chelsea. Thank you. Jersey County. Got you. Good morning, Libby. Macoupin County. No Derek today. Okay. How about Madison County? And Monroe County. Randolph County.
Randolph County present. Deborah's here.
Morning, Deborah. And how about St. Clair County?
Hey, good morning, Lee. This is Tanner with St. Clair.
Morning, Tanner. Beth, I saw you were on. You want to give an update on the REMSC? Oh, well, she's on, but I mean, she may not be hearing me. Any of our EMA agents, I saw Sam was on from St. Clair County. Oh, go ahead, Beth. I saw you unmute.
Yeah, sorry, I had too many mute buttons going. So we do have now officially a new Greg Atterbury. Her name is Nicole Jones. For some of you that have been around a while, you may remember her. She had this job, I think from 2010 to 2012, somewhere in there. And she's been around at other state jobs, and now she's back. And we're very excited to have her. She is in a 2-week orientation now. She started July 1. And she said to tell everybody that she is excited and looking forward to working with everyone. She's very qualified. She's got numerous degrees, including a doctorate now. And she does have some experience, although, as we all know, a lot changes in that long of a time. So I will send her information so you can include her on the email list. And she's, I think, going to be able to attend the next meeting.
All right,
So,
excellent.
Nicole Jones, that's her name.
Excellent.
Hmm.
Any other EMA partners on the call today?
Hi, it's
Anybody
Sam from St. Clair County.
Gotcha, Sam. Anybody from MedStar? I didn't see John this morning. Anyone from Abbott? Do we have any reps from SLU? And how about the base? Anybody from Scott, from Med Group? And then Stars.
Good morning. This is Bridget Farango.
Good
And we
morning,
also
Bridget.
have Sarosha is also on the call.
Excellent. And you guys will also be calling out for the St. Louis Healthcare Coalition?
Yes.
Perfect. Excellent. All right. And I saw there were a couple of phone numbers. I don't know who they are. So the phone number ending in 1044. I got you, Eric. Sorry about that. I don't know how I missed you. Anyone with the 618-283-1044?
That's me at Fayette County.
Oh, okay. Perfect. Just making sure. All right. So we didn't have any due outs or open tasks at the moment. We'll move over to IDPH and let Beth give any updates that she may have. Eric, I see you there. Thank you.
I had to
So
call in.
I just had 2 quick additions besides having a new REMSC. The CDC has ended its emergency response to the H5N1 bird flu. Due to drop in cases, there have been no human cases since February. So they officially ended that emergency. These have a tendency to collate with migratory bird season. So this is not unexpected. The other kind of public health news, not sure again if you guys have heard about it, but we've been having webinars and notices go out. It won't affect us directly right now, knock on wood, but there is it's a flesh-eating maggot that affects cows. The insect is called the New World screwworm fly. Apparently it was in Texas like 30 or 40 years ago, and they eradicated it, and they had a system where they were keeping the flies south of Panama. Apparently that plan was dropped, or it wasn't done right in the last year, and so now the flies are coming back north again. So right now they are starting to go back to the system that worked before, and that's sterilizing a bunch of male flies and then releasing them. It worked well before. The problem is now it's a larger area to try to cover. If this gets up it's in southern Mexico now, if it gets up into the Americas, it'll be devastating to, like I think they said $1 trillion or something crazy with the cow situation, money lost. So there, you might see some information about that going around. And that's really all that I had. I just thought that was interesting story for the public health nerds out there.
Oh, excellent. Hey, Beth, have you seen any statistics on vector-borne disease so far this year? Anything from the mosquitoes or tick carried?
The numbers are a bit high. It's just kind of getting started now, but especially like you said, mosquitoes and ticks. There are a few different kinds of ticks. Normally we worry about the deer tick, I think it's called, but there's one that's teeny tiny and I can't remember the name of it. But there is some concern about that. They have been seeing some. So I know some of the health departments have active vector-borne disease. Have you guys seen any upticks in your mosquito collections and your tick collections?
This is Tanner in St. Clair County. We just had a West Nile case pop up in INEDS yesterday, but other than that, haven't seen a whole lot.
So that's early. Usually we don't see those cases until August or September. Anyone else?
All right. Well, again, thank you for that. I will say the only critter on this earth I'm truly petrified of is the tick, and only because it carries alpha-gal syndrome. I like my red meat. I'd die without it. So anybody that's not aware, that makes you allergic to it.
Yeah, insects
right.
are crazy. Thanks.
No problem. So Bridget, we'll go over to you for St. Louis side.
In terms of updates,
Yes, ma'am.
I was completely prepared for the MRSC. So in terms of the coalition, we started summit. We didn't start summit planning. We started summit planning in April, and we have an annual summit. This will be the third annual. It's typically held in November, and we started summit planning in April. It got interrupted by the tornadoes, and so we just had our second planning meeting earlier this week. We have nailed down a venue. It will be at the St. Charles Ambulance District in St. Peter's for Friday, November 7th. So that is pretty much as far as we've gotten. But if you guys want to save the date, we would love to have you participate in the summit. We have a couple of projects that they're kind of in their infancy, but the HMACS, the Healthcare Multi-Agency Coordination System project, has begun. The first planning meeting with stakeholders is July 15th. We're looking forward to that. It's kind of a revamp of lots of discussion around SMOC and HMACS and the way that this region will be alerted to disasters and how we share information, kind of reorganizing and restructuring some of the planning. We're really excited about that. Just getting everybody on the same page with the same language. In addition to that, we've been introducing EICS. During the MRSC, we introduced EICS to the region, and that whole process went really well. And so it's just a matter of building that out and getting everybody in it that needs to be a part of it. We're going to use that for alerts and information sharing moving forward. The other thing that we've been talking heavily about is Pulsera, and the big downfall is that it doesn't communicate with the Illinois side. I don't think that we're going to solve that problem in the next couple of years, but Pulsera will be a patient tracking system for this side of the river that hopefully eliminates a lot of issues we currently have, which the biggest one is that we don't have a good patient tracking system. So I went to a boot camp that Pulsera put on 2 weeks ago, and the message was well received. There's just, it kind of comes down to nobody wants to commit to saying, let's use this. So I have a coalition meeting with leadership on the 18th of July, and hopefully those conversations will be productive and we can start moving in a direction, because right now we're kind of stuck. There is an HCMA project that the scope has been revised just because the initial scope was a little bit unclear. HCMA is basically a learning platform for emergency management within the region. So it's a platform that they're hoping to build out different types of curricula for different emergency management practitioners. And the original scope was a little unclear about it being adult learning focused. So the scope has gone through a couple of revisions. We're hoping to have the new scope posted to the East West Gateway website by the end of the month. And hopefully that project will kick off in September. Sarosha, do you have anything else?
Sure. I'd be happy to update you all on the regional mass fatality exercise series that we have going on this year. So just to recap / refresh, this is a UASI funded project that is really looking to enhance the St. Louis bi-state region's preparedness for specifically a mass fatality incident, because this came out of our mass fatality subcommittee. They put in the application for it way back as part of the fiscal year 2021 for the UASI grant program. Really, the priority of this project was to test and validate the key components found in a mass fatality resource coordination plan that was created several years before COVID, and really nothing had been done with it since the plan's creation. So we had our first tabletop exercise on June 17th to really just familiarize partners and stakeholders in the region with this plan and start the conversations on what the interagency coordination would look like if there were to be a mass fatality incident here in the St. Louis region. That tabletop saw over 60 participants from about 30 different agencies throughout the region. We had very generous and accommodating hosts up at the St. Charles County EOC, and it was really a good start to this project that is rather large in scope and timeline. We have a second tabletop scheduled for August 5th at Anderson Hospital over in your side of the region. So my thanks to Eric and everyone at Anderson for agreeing to host us there. This second tabletop is going to focus more on a CCTA incident, a critical terrorist attack incident, and specifically look at coordination between our medical examiners' offices and coroners' offices and our law enforcement agency partners. Registration for that is open. We're currently kind of funneling registration through our exercise planning team and focusing on making sure that we have good representation from those stakeholder groups I just mentioned. But if anyone is interested in learning more about the project and how they can attend either this upcoming tabletop or those that are part of phase 2 that will start in September, please reach out to Bridget or I. One of the big takeaways thus far, and something that was very much emphasized in the first tabletop, was how it was one of the first times in I think a long time, if ever, that our region was able to bring together a lot of different stakeholders that really worked in the fatality management side of things and get them better connected to our emergency management, healthcare, and law enforcement partners. So we're very excited to kind of continue those conversations and better outline how different agencies and disciplines will work together and coordinate if there were to be such a large-scale critical incident happening here in the region. So let me know if anyone has any questions. Otherwise, like I said, please reach out if you want more details or want to talk about how you can get more involved. Yeah, that's all I had, Bridget. Thank you.
I do have one more thing. Thank you, Saroja. The Public Health Subcommittee just submitted the scope for a biological threat project. It includes a 2 to 3 day preparedness workshop, and it is culminating in a regional tabletop exercise. So the scope was submitted, and we're looking to kind of kick that off again at the beginning of the fall. And yes, like Saroja said, if anyone is interested in any of these projects, please reach out and let us know. We would love to have Illinois participation. Thanks.
All right. Thank you for that, ladies. Bridget, if you can, when you get the registration for this summit that you're preparing there, if you can send that over, we'll happily distribute that across the coalition.
Excellent. Thanks.
And I know Mike is not here. He's on vacation. As far as REMERT goes, we do have a variety of different things going on this summer. Right now, we've initiated planning for the upcoming NASCAR series taking place down at Worldwide Technology. We'll be setting up the normal treatment area plus a little additional space because this year's expected to be a larger event since it's like some kind of a cup final thing. I don't follow racing, so I don't quite understand it all, but they said it's the big event, so we'll just plan it that way. Next week, actually, REMERT will be supporting the Illinois State Police Youth Academy for medical coverage for their week-long academy for kids. And it's a good little program. It's entertainment for them and us. We've also got the Belleville Marathon coming up, as well as a few other community events throughout the next 3 months or so. If anybody has any questions or interest in REMERT, definitely reach out to Mike or myself, and we'll be happy to assist you with it. There's contact information as well as just what we have on the docket right now. There are a couple of other events that are not listed that are in the works that we're trying to get details on. Eric from the VA, if you want to, just for those that aren't familiar, if you want to explain what the FCC event will, what it is, and then I'll go to your slide you sent me this morning.
Yeah, sure. So the Federal Coordinating Center is part of the National Disaster Medical System's larger coordinating agency to allow us to bring patients from a affected area that has been usually it's natural disaster related, and hurricanes or something of that effect, and people who have been displaced or medical facilities within that area that have been also affected, and they need to offload their patients to a area where the healthcare in that region can take on those patients and exceed the medical care that those individuals need. This was seen primarily during Hurricane Katrina, when we had a lot of medical facilities in the New Orleans area impacted by the natural disaster, and all those patients and people within those medical facilities needing to be treated and elsewhere. And so we were displacing a lot of those folks throughout the country, so that those people could, obviously get the treatment that they needed and the care that they deserve, while waiting to see if they could ever return back to their areas, and then waiting for the healthcare in those locations to rebuild. So this is so the VA has this mission built in. It's baked into our mission sets. And it's one part of it. The DoD has another version of it where you'll see this more indicative of when we look at some of our larger scale operations, like we didn't really see it during Operation Iraqi or Enduring Freedom. But if we had a large scale event where we had to take a lot of service members and that were wounded and they were overwhelming the military medical system, we can get them moved from those theaters into regions where the VAs are at and get them out to healthcare. Again, it's more about what's in that area that those service members need for treatment, and then get them out to the right medical care. So In a nutshell, what you're seeing is a lot of airplanes being moved, or it can be buses and it can be trains as well. So it's plane, trains, and automobiles, and basically getting people moved into the area and then getting them. And this is a federally declared disaster. So I also have to throw that out there. This isn't just somebody creating an idea and saying, hey, we're just going to move folks for the heck of it. It's a federally declared disaster. And these people come in that are tagged by the federal government through a tracking system that is actually used out of Scott Air Force Base. And they are all mission assigned. And they come here, and then we process them in through our FCC, take them out of the military system, which is the J-Patch traces, and bring them into our EM resource or whatever whatever the region would be using. For us in St. Louis, it's obviously EM resource. And then we get them under their social security number so that they can be tracked, and then hospital systems can bill accordingly to the treatment that they are receiving under CMS. So I think that's the highlights of that one. Lee, if you want to go to the next slide. So we ran our FCC last month, and a couple of things that I want to say is first, thank you to all of the both Illinois and St. Louis hospital coalitions, transport agencies, medical facilities that are NDMS, that we have NDMS agreements with, and everybody in between. Without really, this was one of the larger, more community stakeholder events where we really backed off on how many folks within the federal government were really involved and really putting the onus on the community to help us out. And that is huge, and we cannot do without your guys' support. And so again, thank you for all the all the great efforts that that everybody provided and making it a large success. In doing such, the issue that a lot of people didn't realize is right after we had our FCC exercise, and I mean like literally like right after, like within a week or two, the VA St. Louis healthcare system, we got hit with our TJC inspection. So you can see that right, I was working on AARs, trying to get stuff finalized, and I literally had to switch gears into another mode that I was not expecting right off the bat. So right now I'm still working on getting feedback from participants. Some people are still sending me stuff right now, and things are still trickling in. So I'm trying to go through all of those documents and just review what people are writing to make sure that there's nothing different than what other people have seen or observations that are made. And then as I'm building them out, some of them are going to be internal. What I mean by that is some of them are incident command related for the VA folks, and then some of them will be external to this to the community partners. So for everyone to kind of say, hey, this is what you guys have seen, and things that we may have to take a look at organizationally as we respond to more of these exercises, or maybe an actual event or so. So part of that is me closing out some of the resource requests and making sure that if there's any documentation that I owe you, please let me know so that we can get those signed, sealed, and delivered, and so that we can get those taken care of. I have spoken with my PAO, and what we have discussed was trying to make sure that the photographs that were taken during the event, so what you're seeing on the left side, was published in the VA newsletter, is getting the photographs basically approved for release. And so instead of just being able to say, hey, all the photographs are going to be released and I can just give you guys this big mass download, what but the PAO would like for me to do is have the organizations reach out, or I'll just be reaching out to you all essentially, just saying, hey, let's go through all the photos. Which ones do you want? And then get those approved, and then I'll get those released. The reason why is there was about 4 separate PAO organizations that were at this FCC from various parts of the federal government. And because our PAO is going to be the one that's the release authority on all the photographs, they just felt that it would be just easier to do it this way than trying to get all the other PAOs from the other legs of the federal government that were involved into releasing the photos and making this way harder than it has to be. So I know everybody's been kind of wondering, I know I've been hit up by a few folks from the other facilities about getting photos, because obviously you want to update Facebook pages and all sorts of other things and showing the community what we've been up to. So please, if I'm a little slow, just shoot me an email saying, hey, when can we sit down? We'll set up a Teams meeting. I'll go through all the photos. And then once you say, I like these ones and these are the best ones, then we'll write up all the numbers and I'll get those in front of the PAO. And then I'll have them approved for release, or if they don't get approved, I'll tell you why they weren't approved. Maybe there was somebody in the background, like one of the photos that had military members in it, or one of our VA folks, and they don't want their photo being released or whatever. And then we'll just have to find a workaround. Maybe we'll crop it, do whatever, cut some people's faces out, put smiley faces or emojis in their stead. But one way or the other, at least we'll get you some of the photos from this event. And then the last thing is getting recognition. So this is going to take a little while, but we're going to try to work on getting certificates of appreciation or whatever it takes to just get you guys recognized for the hard work and the great things that you've done for us. And making sure that, because the NDMS actually has their own recognition system as well. So I'm trying to figure out what that is. Back in the day, they used to hand out stuff that if you were if you had an NDMS agreement with an organization, they would hand things that they would hand out for their own forms of recognition. So I'm working on a couple of different things. So those are the big high points, and that's all I got, Lee. Thank you.
All right, excellent. Thank you for that, Eric. Turn it over to Phil for what little bit of update we have.
All right. Good morning, everyone. Hopefully everybody can hear me. So the grant period did end on 30 June for BP1. I know we've had some questions out there with regard to when items can be received, at what point in time, if they were late or back ordered, et cetera. What I can get from IDPH, which should not be held up and should be honored, but I cannot get this in writing, something from IDPH, but this is what is honored and what they have provided us. But if your items have been ordered, you've already ordered them, and they can be received before the end of July. So basically you have until we complete our RCF, which basically is our request for funding, reimbursement. It's a report that we have to get in. So you basically have until 1 August for those items to arrive. If not, those cannot be reimbursed. So as far as the BP2, we're in a holding pattern. As you know, we do kind of we start out, 1 July to 30 June each year. And we will have our project window open. We'll run everything the same. What we did get back from IDPH is that they believe we'll get around 70%, at least initially, of what we traditionally receive from ASPR. And I won't know until actually tomorrow. We have a meeting tomorrow with IDPH, so I'll probably send something out just to, after whatever I can glean from that meeting. So again, we're in a holding pattern. I scrubbed, and Lee can tell you I scrubbed, outside of trying to put it all in ChatGPT and spit out something in the HR1, the legislation that was recently passed on July 1st. I believe it was passed on July 1st. Either way, I could not make heads or tails of what was in the budget. So as we kind of talked last time, the initial line item, it was redlined for HPP funds for approximately 240 million. But again, I have not seen hide nor hair of an actual figure that I can provide. The CBO, the Congressional Budget Office, did do an analysis, obviously, of the bill. It changed from the original, I think, $3.4 trillion deficit to right around $3.1 trillion deficit, or thereabouts. So there's around 300 million, or maybe close to 400 million that was added or taken out more of the bill. So just don't know where it's at. And I'll actually kind of lean over and whisper to Beth. I don't know if she's heard anything with regard to FEP funds that may kind of line up with HPP funds before I, speak with Teresa and the crew tomorrow from IDPH. So Beth, do you have any additional information on funding?
So we were notified, it's been a few weeks now, from the CDC. They cut FEP funding. Help me out here, guys. I can't remember the exact number. I want to say 27.52% across the board. We tried to absorb that, but I'm not sure what happened, but we were not able to. So we passed that along to the local health departments. There was an interesting caveat that the CDC was very adamant about, and that was that we do not cut CRI funding. So the local health departments are fully funded, level funding from last year for CRI, but the FEP grants for all the health departments are cut. Again, I'm pretty sure it's 27.52%. As far as coordinating with HPP, I think that we also have a meeting with just the grant people in Springfield in the next week. We've been having a lot of meetings about these. We did release the FEP and supposedly the CRI grant on Thursday afternoon late, but there were a few mistakes, and then they found another mistake or two yesterday. So it is an eGrams, but it's not correct. So they're going through the possible trying to fix the mistakes that they made in the grant application process. Does that help? Is that what you were looking for, Phil?
I mean, that helps. I mean, it tracks with the 70%. I mean, because that's kind of what Teresa said a while ago, but we shall see. I would, again, presume we would probably align with what FEP is doing. So we'll see. And hopefully I can send out an email tomorrow following that meeting. Next slide. I don't think there's anything. Is there anything after this? I don't know if there's anything for me after this. Okay. Yeah. All right. If any questions, anyone have any questions with regard to grant documentation or funding otherwise?
Hey, Phil, I've got a question. This is Wendy.
Hi, Wendy.
So you mentioned that the BP2 or FY26 grant period obviously started, quote unquote, July 1st. What we already submitted for that period, is that still valid, or do we need to do a resubmission?
Okay, so you're talking about the project proposals that we closed out in November-ish. So those still stand. So we will use those as going forward. My goal this year, as we transition with the new arrival, is to kind of we'll have the same process, but my goal this year is going to try to be able to allow you guys to spend money earlier. What we've had some success with in the past is once the Um, once the programmatic review of the grant is accomplished, and that means going through the work plan, and you probably already know this, Wendy, but going through the work plan and seeing what we're spending money on within the budget and
Right.
what actions we're doing throughout the year. What we've done in the past is we've requested that IDPH authorize us to spend, for instance, on training. We had 2 years ago, we had a really big training year. And we leaned really far forward there. IDPH allowed us to spend money before we had an executed grant because they had completed the program review. So we would like to do something similar in this upcoming year. But we'd like to get that down to the subawardees so you don't feel as rushed. I know this year was really painful for some to feel super compressed in their time frame, and then you have events that you want to go to, and then you're afraid to spend because you don't know if BJC is going to reimburse you. So my goal is to get that approval early from IDPH once we've submitted and it's made through programmatic review, and then work with our grants management office on being able to do that. We have not been in a position yet, where we've had to deny someone reimbursement based on a programmatic issue. The only issues we've had have been on the application side, where some folks may have been denied access to grant funds because of their ICQ, their risk score was too high. And that is, a part of being the fiduciary for the grant is to assess those risks and to see if folks qualify for the grant. So we've had some issues there, but over the 10 years of me doing this, that's only happened twice, that portion. And we've never had an incident where we've had someone with a subaward that submitted their documentation, did what they said that they were going to do and not get reimbursed. So we've never been in that position, and we've never had to go back to the state I hate to use the word sue, but there's a process to go back and get funds that were owed, or at least on the HPP grant. We have done that as memorial, but not coalition dollars. We have done that as memorial with some of the trauma funds, but we've never had to do that with HPP funds. So knock on wood, we won't have to do that in the future. And I'm going to try to get it so folks are able to spend as soon as we can get a programmatic review approval from Teresa's team, or who's replacing Teresa, because Teresa will be retiring at the end of this month once this grant closes out. So as the grant closes, Teresa retires. She's done a lot of work, and she has been the longest standing person in that position since I've been doing this, because that has been a kind of a hamster wheel of personnel. So like it or love it, I think she did a really good job with all the things. She made it through COVID. She went through everything. So we're going to try our best this year to make things much easier than it was in the past. Any other questions? All right. All right, Lee, back to you.
All right. So on the EN resource front, I know we have been struggling here internally. Phil and I have both worked on this, trying to find a way to extrapolate a useful bit of information from EN resource. We're getting closer, but we still haven't reached a successful outcome. The long-term hope is that we can actually give monthly updates on where we were the previous month as far as reporting prior to the 10 a.m. cutoff as required by IDPH, as well as hopefully be able to maybe even show a percentage of time in each of the individual statuses for each facility. So how long you were in peak census, or how long you were, open, or whatever the case may be. Just so that we can have a little bit of clarity and transparency that you can share not only with your internal staff, but with your C-suite folks to ensure that they know what's happening. More to come. It's a lot of pain working through Excel. In terms of new business, immediately following this meeting, we will have training conducted by Phil, the master developer here who built the tool for the new member planet replacement that I am extremely excited to have finally live. Phil, you want to give any update on that, and then we'll do the training at 11?
No, just if you can, please be there. We will, at least for the folks, definitely for the folks that are on, we'll make sure your accounts are all squared away, and we'll kind of do a soup to nuts kind of walkthrough of the entire system to make sure that you guys are successful. It's not super hard at all. So, but this will also give us an opportunity to test out some things in a live environment because, like while you guys were going through the earlier slides, I'm over here. I was like, wow, this broke. Let me fix that. I've been fixing things while I'm just getting ready for it. Because I'm like, I'm just going through with the things that I wanted to show folks. And there's still some errors, but that's fine. So please log back on with the invite. I think that Lee sent out at 11 o'clock. So we'll start at 11. We won't start directly here. That way because I know some folks will be joining and at that specific time, and we don't want to have them miss out on anything. So we'll end this meeting and then we'll go into the next one promptly at 11. So nope, just please be there if you can.
And just for everyone's information, the link that you're using right now will be the same link for the new meeting. We'll just end this one so that I can end this recording, and then we'll start the next so that it's a new recording that is specific to the training side of it.
Indeed.
As far as coalition related things, we do have a lot of stuff. We have a lot of stuff that quite honestly nobody but us has seen, and we kind of want to get that out into front of everyone. We'd like to give you the opportunity to see what your grant dollars have purchased over the years and understand what its capabilities are and how to request it and all that kind of fun stuff. August 12th, we will have the decon trailer out at Anderson Hospital. Come hell or high water, I will find a truck to tow it with if ours is not back in service by then. But we will get it there, and we will do a walkthrough familiarization on it, what its capabilities are. We do also have our morgue trailer that's here at Memorial that's parked out back. That is another option that is available if somebody would like to host. We're happy to try to bring it to you. I'll be honest, right now the morgue trailer does need a little bit of work. We just recently found that out, and we got to find a vendor that can support it. And then we do also have the oxygen supply trailer. So this was a pretty big deal for us. If NOAC was on, John can elaborate exactly how valuable it is. But with all of the issues we've had, storms, power outages, so on and so forth, being able to both fill bottles and generate, oxygen in an austere environment is kind of critical. The trailer we have will allow us to do that, and it allows us to do it pretty smoothly. Unfortunately, there's only 4 people left in the area who are actually familiarized on how to operate it, and all of us have other duties. So we want to kind of get some additional folks trained to be able to support this tool if it has to go out, because we would have to send an operator with it who can actually make it work. And since it's, compressed gas and things, not explode. So if you're interested, let us know and we'll happily, again, get that out to you. From an upcoming events, so today we will be doing the training for the new Member Planet replacement. Today is also the last day to register for the TEACS trainings. If you have not already done so, please register for those courses so that we can ensure we still get them. We have to have a minimum of 25. I don't know that we've met that number. I haven't heard the numbers yet. I should get those tomorrow morning since today is the last day to register. But please, if you have not registered, please do so. You can find those on the TEACS website. It's the Understanding Cyber, and then they also have a really good physical and cybersecurity for critical infrastructure class. It's 2 days. They're 8-hour days. They're excellent courses. The regional mass fatality tabletop exercise, which I believe is at Anderson, if Bridget or Saroja can confirm, that's set for August 5th.
Yes, that's right, Lee.
Yep, and then the decon trailer will be at Anderson as well on August 12th. And we have a decon class on September 9th scheduled at Anderson. So if you have staff that need decon, this is an opportunity to do that. And we'll actually show you how to register for that here in just a minute on the upcoming training. So open floor. This is your opportunity. Any comments, questions, concerns, criticisms, please, by all means, let us know. Nobody?
Lee, this is
All right.
Eric. Can you hear me?
Yes, sir. Go right ahead.
I was unable to get on the Microsoft Teams link. Still can't. So I don't know if I'll be able to join your show after this. So I don't know what the problem is.
Okay.
I can't
so
tell
to
if
give
it's
you an-
you guys wanting me to change my password or my facility, but I've tried everything and I can't get through. So.
Yeah, that's probably actually on your facility because I don't think ours even requires a password to get in.
Okay.
Is that Eric, a passport on what specifically? What were you saying?
It was a password. Normally when I would click the link, it would take me to Microsoft Teams, which we typically use Zoom over here. So I had always had a separate pathway to get into your meetings. I mean, when I pull up my user, it pulled me up as a guest of the BJC. So, I mean, that's why I thought maybe it was on your side. But anyway, it's asking for an updated password, and in the banner it says that it's either you guys or my facility. I have no idea. So, I tried to reset it or tried to put in which I know is my current password, and it didn't work. So I'll try again.
Okay. Well, you should. I would think too that you should be able to, if you don't open it up directly in Teams, if you open it up in the browser, maybe you can. I mean, maybe you can just as a guest. I'm trying to think of what other way you could probably log in. So sorry for that.
I've been trying even like using Teams on the web, and
Yeah.
that's where it asks me for my password to access anything. So it takes me to an account, but yeah. Oh well, if not, I'll catch up with you later.
Well, we will definitely be recording this as well, so
Very
we'll be
good.
able to share the recording.
All right, thank you.
Does anyone else have anything?
Hey, Lee, there are a couple things in the chat. I don't know if you saw them.
I did not. Bear with me while I go try to pull up the chat here. TEACS courses are free and virtual. You just have to register on TEACS. The Texas A&M extension is funded through federal dollars. We'll see how long that lasts. But for now, it's there. And Tracy, I see you about the morgue trailer, so I will follow up with you probably next week because I'm going to be out the rest of this week. But I will follow up with you next week to coordinate that. Anyone have anything else? All right. If not, I'm going to give you guys 7 minutes to run to the bathroom before we start training. Please be sure to disconnect from this and then at 11 reconnect to that link, and that'll bring you into the training. It'll just be the same link that you used for this meeting. All right. Well, thank you, everybody.